So I have good news and I have bad news. I'll start with the bad news. The bad news that you are going to be older. And when you get older, your system is going to change. The vision is going to decrease. You're going to have increased tendency to develop cataract, macular degeneration. Your hearing start being impaired. You could develop sensory neural hearing loss. That's why with elderly patients, we usually go close to their ear and talk so that they can understand. Your sleep is going to be disrupted. Your REM sleep, it's going to get shortened. And because REM sleep, that's the responsible for the memory formation. When you have low REM sleep, your memory is going to be impaired and you will start waking up early. So your sleep is going to decrease. Other things that will happen is that your rib cage is going to stiffen and your tidal volume is going to decrease, so your lung capacity is going to decrease. Your gastrointestinal system is going to have slowing in the motility, so you develop increase in constipation. Your bladder is going to thicken, so when you thicken you will have urine incontinence and prostate get bigger, so this worsen the urine incontinence. Some people develop urge incontinence, and when they have urge incontinence, they don't go socialize with people. So when they don't socialize, they could sit on the bed, sit at home all day, and they develop pressure ulcer in their back. And when you can't hear, you have urine incontinence, can't see very well, you tend to develop depression. So this is what we call the geriatric syndromes. Like you have all of these things could happen when you get older. We have expiration date. We are in a machine and we have expiration date. The reason I want you to be aware of those things, because I have the good news. The good news is that there are ways you can prevent that and you slow the decline. The way you prevent that, you don't drink, don't smoke, start exercise, eating healthy, doing intermittent fasting. All of these things is going to increase your longevity and is going to increase your overall health. There are two things. There are functional age and there is the chronological age. There is a lot of the time we see patients in their 80s, they look like 60, and we see patients in their 60 and or 50, they look like 80 or 90 years old. That's all depend on your choice, your lifestyle, and also has genetic played some role, but lifestyle is very important. So if you want to prevent all of these geriatric syndrome and decline, start exercising now, start eating healthy.